Hi, welcome back to my channel. And I have got both dogs here with me today, which you can't see very well because I'm doing a different kind of video for you, in that the background is obviously more important than I am. And I've talked in the past about the use of vibrations in my YouTube video on vibroacoustic therapy. I've written about the use of sound vibrations in my book, Music, Sound and Vibrations in Special Education. I've got a copy here for you to see. It's available from Routledge, and also you can get it through Kindle on Amazon. And there's lots more information in that particular book. But what we're going to talk about today then is a sound bath. Okay, so it's referred to as a bath due to the participants, the students, being immersed in the vibrations of the instruments during the session. Deaf students can benefit, as the resonance of the gong or drum will travel through the body just as it does for a hearing person and can be felt as a vibration. The concept of sound baths originated in Tibet some 2,000 years ago. Most sound baths take place in a room with other students, other people, but some special schools can offer a one-to-one experience if they've got the space. During a sound bath, students can lie down on the mat, as you can see in the background there, with perhaps a pillow if they want, or in some cases they sometimes have a blanket because they do get cold. So that's up to you. The room is often darkened so that the students feel calm, and it heightens their other senses. Instruments that you're using, as you can see again in the picture behind me, can be played from one particular place. As you can see, the gong is definitely not going to move from that place. But sometimes they're brought around the room, certainly the smaller instruments that you can see there, and played over the student's body sometimes. Students are free to relax and drift off wherever the sound takes them. A sound bath focuses on bathing the students in the relaxing, meditative noise of sound waves from perhaps crystal bowls and gongs, drums, tuning forks, or other instruments. The sound therapist will encourage students to relax before starting to play in a nice, calm voice. The sounds will start off softly to ease the students in, but they'll get progressively louder. The volume never gets unbearable because it's being played therapeutically. The playing technique can change frequently so that there's no fixed rhythm. Instead of the noise giving students a headache, sound baths have the clever ability to soothe the mind. In general, students should feel very calm and relaxed after a sound bath. However, on occasion, students have been known to be very emotional once the session is over. At the end of a sound bath, there should be a period of silence, followed by advice and support by the person who's been leading the session. And that support should be given to both students or teaching assistants that are accompanying the students in case they're affected. There are some contraindications, and these are: don't use sound healing instruments on the body if somebody is pregnant. So if you're supporting students who are older, say in a specialist setting, then obviously that's the kind of thing that you would have to check. And certainly you may be doing it privately once you're trained, and it may be a relative who's pregnant and you think, oh, I wonder whether I should be doing this. Well, the answer is no, certainly not during the first 12 weeks, okay? Don't use it if you suffer from sound-induced, if any students suffer with sound-induced epilepsy, okay? And obviously there has to be a consent form signed by the parents or carers before anybody actually receives the sound bath therapy, okay? So obviously the parents will have consulted the doctor to ensure that they receive the right anti-epileptic medication and are in no danger of having a seizure during the vibration. So be very, very careful on that one, okay? You need to keep a minimum distance of 20 centimeters from any implanted heart pacemaker, a stent or a shunt. You shouldn't use it directly or anywhere near a metal implant. Don't use it without any prior, if somebody's got some nerve damage. And it's necessary, obviously, as I've said, to get the parent consent beforehand. And it's important that the person leading the soundbath session has been trained properly, okay? Now, the British Academy of Soundtherapy.com offer certified training, and there are other colleges and academies that offer the training, and it's round about £1,000 to train. But you have to remember that that's a good investment, because that person has got the certificate then. They can train other members of staff as well. So it's not as dear as it sounds, really. Once you've got staff members trained, they can in turn train other members of staff to work with them. Because it's important that all the staff who are providing the sound bath know what they're doing. So they should all really be trained as well. Okay, it shouldn't be just up to the lead, although the lead is obviously in charge. But other people who are in that room and involved in the sound bath should have had some training, so they know what they're doing. Policies, guidelines, risk assessments, evaluation forms, and something to record the sessions on, recording documents, must all be in place before you should begin the first session, okay? All these things must be in place. Governing bodies must be aware that you've brought this new therapy into the school. Senior members of staff must obviously have been consulted before it's even agreed upon, because there's all these background details beforehand. So a therapy session is just as important, as I've said before in many videos, as a maths lesson. And in some cases, it's even more important. Sound healing can alleviate or cure many conditions, such as anxiety disorders, stress, pain, post-traumatic stress disorder. And remember, our students can suffer from that. Mood swings, negative emotions, depression, psychological behavioral disorders. And it can also manifest in emotional and physical healing. It can aid relaxation. It can improve memory and concentration, improve sleep. It can include clarity of the mind and balance, a healthier immune system, enhanced creativity, and overall heightened awareness of self and the environment. Now, this enhanced creativity, sometimes you'll find that the staff who've been working in Soundbath have suddenly come up with all kinds of ideas during that session. So as soon as they go out there, I would suggest they've got some kind of notebook that they can jot down those ideas in, because you often, not always, not for, you know, we're all different, but you often do get clarity of mind and some really good ideas that come as a result of having the session. Jot those ideas down. Now, Cheryl Gallia is the holistic sound practitioner for Ysgol-y-Derry in Wales, and it's the largest special school actually in Great Britain. And when I was writing my book about music, sound and vibration, she was able to tell me that the aim within the therapy, the sound therapy that they use at their school, is for the pupils to be relaxed and happy during their sound bath. They will use essential oils beforehand, before the session has started. Lighting plays a really big part for them in the sound therapy sessions, and they have different coloured materials, as some students are drawn to different materials, and these are placed around their therapy room. Visualization and colour and breathing exercises are a place to start the sound therapy session. So they start theirs with breathing in through the nose and out through the mouth, and working with colours from our chakras. So to find out more about chakras and colours, then you can obviously Google that or any other search engine, or you can always ask me to do a session on those. And obviously there's vibrational instruments. Now, these vibrational instruments are toned instruments to release, as they say, blockages in the body. So there's bells and chimes, hand bells, noted hand chimes and bells, rain sticks, ocean drums, singing bowls, gongs, obviously circular drums, xylophones, and so on. And the room vibrates with the sound. And that vibration is around the room as each student is surrounded by this sound bath, which can change the brainwave patterns to support something called entrainment, which is shared synchronization of the rhythm of the gongs to the person's brainwaves. That's entrainment. So this all aids meditation and mindfulness. Now, this is only one of the many sound therapies, and obviously in my book, Music, Sound and Vibration in Special Education, I mention many different sound therapies, vibrational therapies, and music therapies and aids that you would be able to use in special education, which hasn't got to be just in a special school. It can be for students and adults who have a learning difference. Okay, so sometimes they will benefit from having this kind of help and support. Everybody's different. Some people this is fantastic. For other students, something else might be the key to giving them a better quality of life. So I hope you enjoyed that video. It's a shame I can't show you my two dogs. They're sat behind me and they're very, very contented, and they certainly help me a lot. I hope that that this introduction to sound bath will help you in your pursuit of right kind of education for your students. Thanks very much. Take care. Bye.